Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. Today's episode is focused on our statewide residency program for new nurses across the state of New Jersey. We're joined today by three wonderful nurse leaders who I have the pleasure of introducing. First, we have Michele Roberts, assistant professor at Rutgers University and clinical educator for the NJCCN. Hi, Michele. Thanks for joining us.
Thanks so much for having me today.
And next, we have Joy Bray, a clinical nurse educator at Capitol Health and clinical coordinator for nurse residency program at Capitol Health. Thank you for joining us, Joy.
Thank you for having me today.
And finally, we have Lorraine Kane at Holy Name. She's a clinical educator, onboarding specialist, and residency coordinator. Thank you for joining us, Lorraine.
Thank you so much for having me today. I look forward to the conversation.
So first, we're going to start with Michele. Could you tell us a little bit about the statewide residency program, what its goal and intents and purposes are, and how it came to be?
Sure. So during the pandemic, and even before the pandemic, there was a recognized need in the state of New Jersey to promote or improve the ways in which new to practice nurses were being acclimated to the practice environment, and also secondary to that, to improve retention. So what had happened was Dr. Edna Cadmus and Dr. Terry Worsmer had looked throughout the state, and they published an article in 2019 on what the practices used for nurse residency programs in the state were. And they found a lot of disparity in program length, in program content, in how rigid programs were in requiring attendance versus not requiring attendance. And what that led to was a higher attrition rate for, staying in the job for the first year. And also just from the residents' experience and new nurses' experiences, they were kind of not especially satisfied with their experience in residency. Some of the common issues that they identified were that sometimes they wouldn't be allowed to go and get the benefit of residency because of staffing needs on a unit, or that they were told their orientation and residency length would be maybe, a year and they only got 10 months or what have you. So through all of that research that was done, some issues were identified. And then Dr. Cadmus really wanted to work to impact what those issues were. So around that same time, she had learned of an effort to, on two levels, one, increase healthcare apprenticeships at the statewide level through funding from the New Jersey Department of Labor and Workforce Development. And two, just from a national perspective, there was a desire to expand healthcare apprenticeship in general. So Dr. Cadmus really worked to try to see how we could try to frame nurse residency program around standards for apprenticeship, and in learning what was being done in some other states that kind of had worked to form statewide collaboratives or statewide coalitions to promote nurse residency. Using Maryland, I think at the time, maybe Pennsylvania had already done it as well. But they all happened around the same time, 2018 to 2020. People were looking at doing this, and we were able to frame a statewide nurse residency program for New Jersey nurses around the United States Department of Labor standards for registered apprenticeship to be able to be eligible for funding from New Jersey to support the residency program. So what we ended up doing was we compared those standards of apprenticeship to the curriculum that was offered by the commercial product that we use for our nurse residency program, which is a company called Vizient. And through doing that, we were able to crosswalk all of the standards and the competencies that are expected for a registered nurse according to the Department of Labor with the competencies and expectations of the Vizient curriculum, and be very satisfied that we would be able to provide this training using this model and be able to meet the grant requirements to receive funding from the state to do it. So through that, we began in August of 2020. And I think initially we had about 1,800 hospitals that served as partners with us in this effort. Today, we're up to about 23 hospitals, and we've enrolled over 3,000 nurses in this program. And I'm very happy to say that in doing that and in partnering with our hospitals, our attrition rate is 11%. Versus a national average attrition rate somewhere between 21 and 24%, depending on what literature you read, which equates to millions of dollars of cost savings for our facilities because they don't have to replace nurses that are leaving within that first year the way nationally that occurs. More importantly, too, we've been able to expand the number of hospitals that we have. Like I said, we're up to 23 now, and there is word that there may be more coming in with us. And honestly, our data just shows that, overwhelmingly, our nurses are meeting national benchmarks for measures used of nurse transition, primarily something called a Casey Fink New Graduate Experience Survey, which looks at first year of employment factors of feeling supported in the work environment, feeling that they have resources that they need, feeling satisfied with being in the profession, etc. And we're very consistent with or above what the national benchmark is. So it's been pretty successful.
That's absolutely phenomenal. I have so much joy that I'm sharing with you, and having half the attrition rate of the rest of the country, like on average, that's just insane amounts of progress. What tremendous progress. So congrats, Michele, to you and to the team for being able to, in only a couple of short years, show that level of success, and to the degree that you're also be able to support our new nurses. Coming into a not completely post-pandemic world, but coming into this world in which the pandemic has shifted things tremendously, being able to support our new nurses in staying in the profession is just what an amazing effort you've done. What an amazing outreach in service you've done for our nursing community. So I think we're going to be able to bring that to life a little bit more in engaging with Joy and Lorraine, who both work as clinical educators and who engage with the nurse residents in their individual facilities. So we have a couple of questions for them. And for some background, I'd love to hear first from you, Joy. Could you tell us a little bit about your hospital system, your location, and your bed size?
Sure. Currently, I'm with Capital Health, and we came in August of 2020. We initiated our program. We are located in two areas. We're in Regional, is located in Trenton, New Jersey, and Hopewell is located in Pennington, New Jersey. And there's approximately 400 beds between both campuses.
Could we also hear from Lorraine at Holy Name?
Sure. So I am part of Holy Name Medical Center. It's actually a faith-based Catholic healthcare system, which provides care to a diverse population. Hospital is located in Teaneck, New Jersey. It is a small community hospital, so we have 361 licensed beds, and the hospital has approximately 12,000 inpatient admissions each year. So it is a small community hospital.
That's wonderful. And for both of you as clinical educators and working with the residents, could you tell us a little bit about what your roles are like? Starting with you again, Lorraine.
Currently, I am the residency coordinator, and my responsibilities range from coordinating the resident schedules, when onboarding new residents at the beginning of their employment, completing gains grants timesheets, participating in check-ins, updating the residency curriculum, providing individual support when needed to the residents, assisting in evidence-based MPI projects, and then also mentoring new nurses.
And if you happen to have a ballpark idea off the top of your head, Lorraine, would you be able to share about how many new nurses are you working with at any given time?
I would say about 40 to 50 at the same time.
That's a good cohort. That's quite a number of nurses. And Joy, what about you? Could you tell us about your role?
I am one of two coordinators at Capital Health, and my partner and I do different things and similar things as well. Pretty much my role specifically is to look at the curriculum, edit it, update it. I create any new things that are in line with the Vizient objectives to make sure they're meeting those standards of practice. I also facilitate classes. I also attend open houses and interviewing processes like that. And I also do nurse residency orientation processes. So my partner does pretty much in lieu what the scheduling, getting those schedules set up. I also collect the hours and submit them to the state because they have to be submitted, which is part of the collaborations and DOL's requirements to report those hours. So I do a big part of that.
That's wonderful. And about how many new nurses are you generally working with at a time?
We have 2 cohorts, but they're broken up into January, spring, which we merged together, and they average about 70 at one time. And then our newest one that's coming in, that we have coming in, is over 150 that we're going to be starting with. It's very challenging handling these large groups, but Kim and I and other facilitators, we coordinate that throughout the year.
So you're saying that you have 2 implementation points, 2 points at which the nurses come in and enter the residency program. Could you tell us a little bit about how you implement the residency program over the course of a year, maybe?
Okay.
Or whatever the timeline is.
Timeline is 12 months. We do meet with them every month. Sometimes the hours are a little bit more than 4 hours and structured, but it begins with an open house and our orientation, a house orientation wide. The cohorts come in twice a year for us, and we have January and April, and we merge that into our winter group. And we have an average about 70, not from each cohort, but collectively. Then the second time of year that we bring a cohort in is our summer. And we usually get those graduates from July and August, and we merge that group in. This current group coming in, we have 25 starting this week. And in August, we have over 90 that's starting. That group will be together. So that's how we structure that. Then they meet, we break them up. Then they meet with us every month for each of those sessions. And like I said, some of those structures are 4 hours, some of them are 8 hours, depending on the content which we're delivering for that course of the year. So it's for the whole year. Then they have a graduation. And then after the graduation, we have what is called enrichment. So, and they follow up and they can go to different areas of specialty that they have of interest. But when they first start, they rotate. They do not get hired directly into a unit. So they get the opportunity to rotate to different units and select 3 specialty areas that they can consider. What we found is our retention, by empowering them to be more selective in their particular area, we find that our retention rate is more and our attrition is very low.
Do they receive some coaching or some guidance through the process of selection? Is it the selections are made toward the end of their 12-month residency program?
Well, actually, they rotate right from the beginning, come in. If some of them want to go directly into specific units, so we set that up and we take them out of the rotation immediately. If they, like the emergency room, hires directly. Some unit, they have talked to managers and they want to go right in, so we'll take them out of the rotation. But the majority of them don't know exactly where they want to fit in. This gives them an opportunity to kind of feel out the environment, feel out the culture of that particular unit, see if it's a good fit for everybody involved. And they usually stay in areas that they have an opportunity to make a choice. What they do is they get an opportunity to pick a select top 3 and then 1 specialty area to consider. The specialty areas they don't always get into, but they do have an opportunity to interview for that specialty. And if they have an opportunity or open for that, or they may be considered if they are offering that position. But they do have a choice. They give a selection. Then we meet like a round table after all the interviews, and we discuss and look at their top ones, and we try to put them in at least their top 3.
I see. So this is very different from when I first left the nursing school to go join the profession. So they get to choose ahead of time and then select from amongst certain categories that are available. And then for that year, spend 4 months up to 4 months in each of those locations.
No, they visit within a 4 to 6 week span. They rotate right from the beginning. So they go to different units. Kim makes that schedule so they are allocated to different units at different times. Not everybody's on the same unit. So they get to rotate through all the med-surg tele guaranteed. The specialties is just specifically on their top request, and we have to make arrangements for the specialty areas. So that's a little different. So yeah, they rotate right from the beginning for a certain amount of weeks, and then they get to choose, and then we try to get them assigned to that particular unit that and their type choices.
As a med-surg nurse, that warms my heart. I'm glad everybody gets to experience med-surg. Such an interesting process. So thank you for sharing, Joy. Lorraine, would you be able to tell us a little bit about how it works in your hospital?
Absolutely. So ours is unlike Joy's in Capitol Health. We actually hire into specific units. So you would interview with HR, and then you would also interview with the manager of the unit, and then you're hired by a specific unit so that you would work there and not float. We actually hire our residents into cohorts on a monthly basis as opposed to two different cohorts. So we have onboarding of residents each month. So it makes sometimes a little bit difficult with our topical sessions because you have individuals that have maybe just started that month, and then you have individuals that are 9 months into the program. But together they come together, and I feel like there is a good component to this where the brand new nurse is receiving information from a nurse that has maybe a little more experience than they have. So this sharing of knowledge is actually a good thing we have found in our topical sessions. Also have our topical sessions 4 hours every month, but we host 3 different classes during that month. So if a resident is unable to attend a topical session or the classroom work, they can attend one in the next 2 or 3 weeks. We give them the best opportunity to be able to be there for the classroom information. We also allow, for the most part, our last hour to 45 minutes of our classroom is their time to reflect on their practice and discuss any problems or issues that they're having within their units, so that as a collaborative group, they're able to come up with some solutions or what worked best for them in their practice. Or so I feel like that helps each other out significantly for helping them in the bringing that information back to their unit. So we also, at the beginning, right after residency, after orientation, we host intro to residency. So that is what is expected of them throughout the year to 14-month process, which includes the 2,000 on the job training hours. They also get 144 didactic or classroom hours, which I think is the standard, if I'm not correct, Michelle. And then they have a Think course, which is a 2-day course that helps hone in on assessment skills and whether it be cardiac or respiratory. So we found that a lot of the nurses really enjoy this course. We incorporate a lot of simulation during this time, so they're able to practice on mannequins and get a little more confident in their skills. We also run a 8-hour IV course, so they are confident in, starting IVs. We do have them start on fake arms so that they get the skill down on how to, insert a angiocath and then applying the dressing, etc. And then our last class, which we don't incorporate during the first few weeks, but we do incorporate it later on, is the end of life course, which sort of goes over hospice and palliative care, et cetera, which we might be changing in the future because we find some of the units are not getting a benefit from that class because they don't see as much end of life care as other units. So we might be switching that soon.
Yeah. Most at Capitol Health too, our topics are similar outlined as well. We meet monthly and we engage. We incorporate a lot of, we have the Price is Right for time management. We have card games. We also use Poverty Sim interactive throughout our sessions, which we find that the PowerPoint can be overly used, and we try to use and all the games. Escape room we also have for wound care. We have a lot of competitive building opportunities to kind of build that teamwork, to development skills for stress management, how to handle that. And we incorporate that in each of our topics. We even have pet therapy come in. We have actual pets come in, and we talk about those challenges that we can meet in our professional role and how to handle those as well. So it's being creative, and I think Vizient has offered that structure and providing those other examples and stuff to incorporate it and to make it more interactive and engaging.
I love that. You both just took the words out of my mouth, because my next question I was going to go into is just, you both touched on the topic of curriculum development. And I'm sure with each graduating set of nurses that graduated under their own set of circumstances, the needs of the nurse residents probably change, and the requirements for getting them up to those competencies probably are shifting as well from group to group. How is it that you develop or approach developing the curriculum to really match the needs of your residents?
Well, for us, we look at our Casey Fink and our skills, that data, and it kind of drives us and helps us motivate. Also, we listen. We have those evaluations for each of our sessions, and we look at those collectively and try to, look at that information. But, each cohort is different. what is not successful for one is beneficial for the next. So you kind of take that, you look at those data-driven things and help us guide in those specific topics. Like Lorraine had mentioned, they have an 8-hour IV. Well, that's one of their driving things, that they always want to get practice and skills. So we've set up little areas where they can, 4-hour sessions where they can actually go get hands-on and incorporated that into their skill throughout the year. It's not like part of the session, but it's an activity for practice skill enrichment. Also, we have other nurse educators who facilitate education for some of our topics, and they take a hands-on approach and help be proactive and gaining in their leadership as well. So we have seasoned coming in, teaching a topic, they run skills sessions, and they help. So other residents listen to senior residents, they kind of like, oh, I understand. I've been through this. So they kind of engage, and it really encourages that.
I think that for us here at Holy Name, we also engage the students with fun activities outside of maybe even nursing. I played a video in my last topical session, which had nothing to do with nursing, but it was more of, can you see all the changes that go on in a short period of time in a video? So I think it's very important with this new generation of nurses to incorporate fun, exciting activities for them, which also includes a lot of simulation. Some of the nurses don't exactly enjoy simulation because they did it so often in nursing school. But I think it is a wonderful way for them to improve their skills without being so nervous of hurting a patient. So I think we do incorporate a lot of that simulation in our topical sessions. And then we also have fun. We play games. One time we had strings and cups, and it's really, and a hula hoop. So I think it's really important to incorporate outside things that maybe don't necessarily include nursing, but more of teamwork, team building, etc., so that these games they do together shows that, how important it is to work as a team to get something done or to get to the file. We did puzzles. So there's a lot of ways that you can, engage the new nurses without having to just hone in on just nursing as their learning experience.
That's beautiful. And I think, how many other ways can you also just show that you care by being creative, by thinking, by all these efforts that you're putting in? I am certain that if I was a new nurse walking into those programs, I would recognize the amount of effort that was being put into helping my transition, because it's a difficult time. We all know, we were all there at one point. The first year of nursing is a hard one. So to receive that support is just amazing. And also, Lorraine, you had mentioned carving out that time for new nurses to engage in self-reflection. I think that's marvelous. Really gives them a sense of ownership over their practice to be able to reflect, because I feel like that first year can be go, 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 pick up your skills, keep working. But to be able to reflect on your practice, I can't see how that wouldn't help with retention, because you're really taking ownership for yourself over your development and growth. And that's just super cool. I also, Joy had touched upon this. So I'm curious now, from your perspective, Lorraine, what's the feedback that you get regarding the nurse residency program from your seasoned staff nurses? Because Jory was saying that she gets that engagement with her seasoned nurses as they engage with the program in support of the new residents. Do you get any of that feedback as well, Lorraine?
I do think that a lot of our seasoned nurses feel that the program is very beneficial, although I think as a whole, it could probably be more out there about the program and the benefits of the program so that we would have more people on board. We do a lot use our content experts to facilitate these classroom stuff. So I don't know how much the seasoned nurses know about the program outside in the hospital, but I do think that they do realize that this does provide a huge benefit to the nurses, but we don't exactly poll or get feedback from them. We do get feedback from the nurses at the end of the classroom setting to see what we could do better for them in the future. Can we change stuff? Can we rearrange the classes, maybe touch upon a different topic? So I think we, as a whole, we focus more on the residents as opposed to the seasoned nurses, because that's really, the residents are what's going to drive the program in the future so that we can change it and make it a little better, in the future for them.
Well, just let me clarify. It's not seasoned nurses that are implementing some of or participating in our open house and our skills. It is our residents, our previous residents that have completed the program, and that they're coming back. And I have one that facilitates one of the topics in our nurse residency. And he's, with my guidance and structure and helping him. He actually facilitates the topic to his new cohorts that come in. A lot of them will come to the open house and introduce themselves and tell them what their experiences were and share what they were, how they started in a nurse residency program. So it's a reflection. So it's not seasoned nurses. It is our nurse residents taking ownership and engaging in future residents coming in and being supportive and being proactive in their educational learning process. That's what I meant, not seasoned nurses. So I just want to clarify that.
No, absolutely. What I was getting at actually is that I just thought it was so interesting, the dynamic, because if we're talking about the outcomes and the benefits for the nurses, while we support the nurses coming in, of course, the rest of the staff nurses who are on the floor who've been serving are going to get benefits because these new nurses coming in are coming in with better knowledge, better equipped, to do their jobs and to come in on their hands, in the action already. Right. So I just think it's fascinating to think about how these, starting a nurse and a residency program has ripple effects throughout the organization of who is able to benefit. It really goes not just to those new nurses, but to the patients, to the seasoned nurses that they're working with, to the educators, and to just the whole community of practice, which is just such a marvelous thing.
One of the benefits is that the nurse residents, it's been a incentive about our rotation. That's the most popular thing that draws numbers to our organization because they have the opportunity, and we're the one rare that come and gives them that opportunity to rotate to different units. So they word of mouth from residents and going into different schools, they're coming in droves. That's one of the advantages of that particular piece.
And that definitely, I'm sure, cultivates the culture of wanting to have continuous learning. Because if you're attracting people who want to get out of their comfort zone and try new things, you're bringing in these new nurses who are flexible and adaptive and who want to engage, then your culture within the community of nurses you employ is going to be fantastic. So that's just beautiful to hear as well. For either of you have an experience you'd love to share about one of your nurse residents or any stories you'd like to share?
I think I can go ahead and share a story. So we have nurses that get employed by our labor and delivery unit, which is not similar to in the past, because to be hired, I remember going to nursing school and all the nurses that wanted to be in labor and delivery, but they knew they had to get their 2 years of experience or their experience before they were hired. So now, with a nursing shortage, we hire into all specialty units. So we had actually a nurse that came in and she was hired by our labor and delivery, and she had felt that she was not meshing well with her preceptor. Her name got out on the unit that she was an unsafe nurse, that she was making a lot of mistakes. It got all the way up the chain of command that she didn't seem like she was going to make it, and they were going to end up terminating her. So she came down to us one day very upset. I gave her a lot of credit for taking the initiative to come down to my office to discuss with me what she could do to get her to where she needed to be. And we coached her through it, me and another coworker of mine. And we discussed with her, maybe it's just that you're not meshing with your preceptor. Maybe you should request a new preceptor. And you really need to take the initiative to go home and research. This is a very specific unit that's very different than every other unit your med-surg nurses are going on. So I think that you really need to put your best foot forward and your greatest effort. And I know that you can do this. I know that you're going to be successful, but you just have to put the effort in. So she did end up speaking to her manager, and they coordinated it that she was going to get another preceptor. And now she's actually doing fabulous. She has finished her orientation period, and she recently came down and told me that because she had such a negative experience at the beginning, and she felt almost to the extent that she was being, personally attacked, that she wanted to be a mentor to new nurses that felt like her that are now coming onto the unit. So I thought that was a really positive experience, that she was able to take this negative experience that she had at the beginning of her orientation and take it further, where she feels like she's going to be able to be a mentor to the new nurses that are coming on her unit now.
What a turnaround. So Lorraine, nurse educators are heroes. Can't change my mind. That's wonderful. That could have ended in the attrition rate, that could have ended in a nurse walking away from the profession forever. But instead, that's somebody who is now not just glued to the profession, but glued to making it better. So, what a triumph that is. So thank you so much, Lorraine, for sharing that with us. Joy, any stories you may have of any of your nurse residents?
Well, there's many stories. Many stories. I don't even know which one to home in on. There's so many. I've had them, one particular that came in and wanted specialty and was not awarded that opportunity to get into labor and delivery as well. And the benefit of going to and took everything and every opportunity on the med-surg tele unit that she went to. Kim and myself, we both helped her transition into that role about a year and a half afterwards. And we helped her transition into that new role that she wanted. She's also back in school. She just finished her nurse practitioner and she is now in the labor and delivery. And she is a very successful and strong candidate in that area. And it just shows where we try to encourage them to take every opportunity. You may not always get the area you exactly want, but if you grow in it and just take every opportunity to just absorb that knowledge, Kim and I, we help them transition into their specialty roles wherever they want to go. We don't want to hold them down. We want to see them where they want to go, and we help them.
We know that there's such a need for people who are passionate in their specialties, passionate in the nursing curriculum and the field. So it's just wonderful to be able to hear these stories and remember that despite the hardship that comes with the nursing shortage that we know is just acutely felt everywhere, that there are people out here that are supporting, that are pushing, that are advocating and championing for our nurses to be able to take care of our workforce, take care of our nurses. And with that, I have one final question, something that we ask all the nurses that come on the podcast that I'd love to hear from all three of you. We ask everybody, and yourselves included, how is it at the end of the day that you take care of yourself? Lorraine, let's start with you.
So what I think I do the most is I attend yoga. I love yoga. I'm sorry, I'm going to cry because I feel so passionate about it. And it really helps me mentally and physically to do what I do every day. Yeah, I think that you really need an outlet.
Absolutely. I feel it too. I actually am constantly I'm in a moment of being able to hold back my emotion because this is a profession. This is a career that I love. This is a profession in which, our workforce has definitely not had the easy side of the stick by all, intents and purposes. We have seen it in our colleagues. We've seen it in ourselves, the level of burden that comes with loving and caring in this profession. But we're still here. We're still moving forward. And every day, every one of us in our own little corners of the world, our own little corners of New Jersey are doing our best to make it through and to help build up the next generation.
I think that it's also important for us as experienced nurses to teach these nurses that you need small doses of self-care. I went to the PTAP conference down in New Orleans in April, and we had an amazing speaker down there. And his whole premise was that you need small doses of self-care, and it doesn't have to be a 2-hour workout, or it's more of just stepping away, deep breathing for a very short period of time to prevent that burnout. So I think as a nurse, the residency coordinator, I like to emphasize this a lot in the program so that they know that there is avenues, and they do this self-care right from the beginning of the program. They learn the avenues so that it prevents that nurse burnout, because it's very hard for them, limited patient ratios, etc. I feel like the burnout is apparent during even the first year because of all this burden is put on their shoulders right at the beginning. So
absolutely. And again, just why the residencies are so important. So thank you so much for coordinating your residency that's changing lives of new nurses. And Joy, what about you? What is it that you do to take care of yourself?
I take walks. I like to read. Sometimes I have all day Netflix day.
We all have them. Yep.
My mind to zone out. And also, because I am a social bug, I've recently joined a church and doing Bible study and just having interaction outside of nothing to do with nursing.
Oh, yeah, absolutely. Giving your space to be creative and to be outside of the field, to recharge when you're back for when you're back. Absolutely. And Michele, last but not least, what is it that you do to take care of yourself?
I'm way too diverse in the things that I try to get interested in, and that in and of itself can be overwhelming. But usually the best way I find to take care of myself is to just do things that don't require me to have to think or respond. And in those ways, what I really enjoy doing is either paddleboarding if the weather is nice, like it is right now in the summer, and because just being out on the water without any technology, phones, I do bring the phone, but I don't turn it on just in case, God forbid, if something happens to me and I need to call the Coast Guard, but, not checking the email, not responding, the way that you are kind of conditioned to do when you're home or at work or woodwork. It's another thing that just requires me to just be in the moment, taking care of a project. And you really can't stop in the middle of trying to finish a piece of wood to answer the phone or respond to an email either. So anything that removes me from the things that you're compelled to do by work, I find is really good for self-care because it allows you to focus your energies elsewhere.
Thank you three for joining us. It has been such a pleasure to hear from you and to listen to all of the amazing work you're doing. So glad to have you, and thanks so much.
Thanks for having us.
Thank you.
Thank you for having us.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.